So in this tutorial, we're going to speak about investigations of sickle cell disease. For the investigation, we start with the disease. The disease here is going to be sickle cell. So how do you support that the patient has sickle cell? To support that the patient has sickle cell, the first test is to do a full blood count. Is it clear? Generally, on a full blood count of patient has sickle cell disease, they have a high white blood cell count. They are going to have a hemoglobin. HB level is going to be low, generally approximately 8 grams per deciliter, because we said that they have a chronic hemolytic event. And then the last one is that they have high platelet count, thrombocytosis. Is it clear? So those are the three major elements that can tell you that the patient is sickle cell. And now you need to also assess for the red blood cell distribution width for the size. Is it clear? Red blood cell distribution width for the size, that is RDW size width. Is it clear? Now you need to know that generally there is going to be a large spectrum of the size of the red blood cells. Is it clear? As I've already told you, it means that there is anisococytosis. Anisococytosis means that there is a large spectrum of the size of the red blood cell, different in size of the red blood cell, meaning that there is anisococytosis. Is it clear? Is it clear? So anisococytosis can come as a result of excessive formation of the reticulocytes. Is it clear? Excessive formation of reticulocytes, which are large in size. You have excessive, you can have also a consumptive vitamin B12 deficiency. You have consumptive vitamin B12 deficiency, because you need to know that generally when patients are going to have consumptive vitamin B12 deficiency, generally you need to know that when patients are going to have excessive production of the red blood cell from their hemolysis. When patients have excessive production of red blood cell from their hemolysis, you need to know that this red blood cell can consume the vitamin B12, which is actually used for the production of this red blood cell, and then they are going to finally have a macrocytic anemia. So at the beginning, they have a hemolytic anemia, which is going to be normocytic normochromic. But later on, if they consume too much vitamin B12, in the case of the production of red blood cell, they can have a macrocytic anemia, which is going to be another reason for the anisococytosis. So they are going to have a large red cell distribution with red cells for the size. Is it clear? So now another reason now is, why is it that this patient have an increased white blood cell? Is it clear? The patients in the sickle cell patient have an increased white blood cells generally because they are going to have an increased white blood cell generally because the reticulocytes, since it is a machine that is evaluating for the white blood cell count. Is it clear? And for the full blood count, it is not a human being. The reticulocyte is going to be confused with the white blood cell, so it's going to show you actually a faulty elevated white blood cell. Is it clear? It shows you a faulty elevated white blood cell, and that faulty elevated white blood cell account for the reticulocytes, which are also elevated. Is it clear? So those are the parameters on the full blood count which can tell you. So we have the first one, you have white blood cell, you have the HB level, you have the platelet, and particularly for the HB, you can have two types of anemia in sickle cell. You can have the first anemia, which is normocytic normochromic as a result of hemolysis, and the second anemia can be macrocytic hyperchromic, macrocytic, in a case where you have a consumptive vitamin B12 deficiency, because if there is hemolysis which occurs for a long period of time, then you are going to have macrocytosis, because the vitamin B12 has been consumed excessively to replenish those red blood cells that has been destroyed. Is it clear? And then there's a thrombocytopenia, thrombocytosis, as a result of the increase of the bone marrow proliferation. Is it clear? So generally those are the elements that you have to bring. Now the second element is now so that's for the investigation to support. Another element to support is a sickling test, but in the past this was used in confirmation, the sickling test. So in sickling test, you place the Vaseline, you have Vaseline inside a lamel, and then you place blood of the patient. Is it clear? You spread it. Is it clear? Place blood of the patient in that lamel. Then you close the lamel and wait for 1 day. Is it clear? The next day now you come and see the red blood cells. You see that all those red blood cells are going to be sickle shape. Is it clear? Why? Because that vaseline that is inside here prevent oxygen from perfusing those red blood cells. And when oxygen does not perfuse those red blood cells, you have now sickle shape red blood cells. Is it clear? So that is in the case of a sickling test. Now the next test now after the sickling test, we have now the hemoglobin electrophoresis. Is it clear? So the last test now to confirm sickle cell is the hemoglobin electrophoresis. So for the hemoglobin electrophoresis, it actually gives you the spread of the different. It gives you the different hemoglobin that you can have. Hemoglobin, the percentage of each of them. You have hemoglobin A percentage, the sickle cell hemoglobin percentage. You need to know that when doing electrophoresis, you need to know that they place the hemoglobin with different electric currents. Is it clear? Different anodes. There are different anodes, and you need to know that each of them is going to have a particular. You need to know that each of them is going to have a particular presentation on these spectrums. Is it clear? So each of them have a particular presentation on this spectrum. So that is for the HB electrophoresis. It can tell you the percentage of the sickle cell hemoglobin that is present. And in this case also, this is also going to help you to assess for if a patient is actually AS or SS. So if you have 50% of adult hemoglobin and 50% of sickle cell hemoglobin, means that you are AS. If you have 90% of sickle hemoglobin and only 10% of adult hemoglobin, means that the patient is already sickle cell. There is a predominance of the sickle hemoglobin and all that. So that is for the diagnosis of the disease. For the diagnosis of differential diagnosis, you're going to visualize that in each of the diseases. Is it? Because we're not going to speak about that. For the cause of sickle cell, as you have already explained,